All right, here we are, the last chapter. Congratulations to all of you that have made it this far. I hope you enjoyed the class. I hope it was beneficial to you. Um, I hope it helps you in your future relationships. Most importantly, I think. Um, so, uh, Sexual diagnoses from sexual dysfunction to stigmatized and normative sexual variations, right? So fetishes, uh, physical issues, mental issues that keep interfere with you having a healthy sex life, and then things that are stigmatized, right? How do we view certain sexual behaviors, right? And I'm not necessarily, I'm going to go do this really quick and then I'm going to show you some stuff out of the DSM. So, normal sexual behavior, the physical challenges to normal sexual behavior. I have physical sexual dysfunction between my arousal and my ability to have sex physically. Diagnosis, and we're going to talk about the DSM, and I'm going to show you some of the DSM. Uh, Extreme sexual behaviors. What do we kinky sex? What do we see as healthy, normal, average? All those things, right? Cultural, religion, all those things that we've talked about many times in this class. As your discussion assignments. Diagnostic models of human sexuality, right? So obviously, we've talked about this too many times since the 50s and the last 75 years, particularly, I guess. Um, Many things have changed about how we're here in the United States, we view sex, but I think also around the world, things change. Obviously, things change in 75. News to you. Um, what diagnostic criteria is and things like that, right? Um, Paraphilia replaced perversion as a term, right? Back in the day, we used to think people paraphilics were perverts. Right? That's how it was described, right? Uh, in the DSM, when I started my career, it was the DSM-3, where homosexuality was still listed as a mental disorder. Right? That changed in the 4, but that was not that long ago. I started in this field later in life, and that was in the like 90s. So, uh, so understanding sexual behaviors, paraphilias, things people are attracted, sexual um, things that attract us that are not the usual, pornography, masturbation, the physical issues that drive us, the physical challenges and desires for women, right? Female sexual arousal disorder, the inability to have or maintain sexual excitement. Men have erectile dysfunction, right? But there is much more ability to overcome these issues now than there ever was before. Um, And as usual, people are embarrassed to talk about this. They don't want to reach out for help. And of course, then that causes a lot of other issues. Um, all these physical things that may cause problems. And then the DSM. I'm going to get to this pretty quick. Paraphilias do not require or necessitate psychiatric treatment. And that says, I am sexually excited by women's shoes. I am sexually excited by something that's not typical of youth, right? A particular, I am sexually excited by women's fingers. I am sexually, so different things happen. Paraphilia, what used to be um, seen as very strange is not so strange anymore. Uh, Extreme sexual behaviors, they're non coercive, but uh, they test the limits of our culture. Compulsive sexual behaviors we're unable to control, sexual addiction, right? There is sexual addiction, there are sex addicts, hypersexuality, uh, right? Frequent and sudden expressions of sexual shame, sexual compulsivity, right? Uh, the shame over how I feel or what I want sexually causes me problems. Again, I'm unable to control my urges. Same thing. Talking a lot of sex addiction, right? I talked about this. Paraphilias. We're going to show you some more about this. Coercive and non-coercive paraphilias, right? Same thing. Force versus no force. Fetishisms. Mm. Two main characters. So this is out of the DSM. They must last 6 months. They must be reoccurring. Mhm. And they must has not acted on these. And then there's other specified. And I'm going to show you all this on how the DSM works real briefly. Voyeurism. I want to watch other people. Exhibitionism. I want people to see me. Fraudurism. I briefly touched on this when it was a chapter or two ago, right? You're on the bus or you're in a crowded place and people are rubbing up against you or touching you. They make it seem like an accident, but it's not. And that person is getting sexually excited by touching you. Pedophilia, obviously, is children and minors. Sadism, masochism, right? Inflict pain on others or oneself. I like the pain is what gets me sexually excited. Sadism on that person inflicting that pain gets me sexually excited. Bondage, sadomasochism. I enjoy being so. That's a whole level of sex that many people enjoy. Uh, Again, transvestic disorder. You get aroused by wearing clothes from the opposite sex. Autoerotic asphyxia. Uh, Choke themselves during masturbation. Unfortunately, every once in a while there's an accident and people die during this process, but or people like to be choked. There's people that like to be choked during sex. I have a robot fetish. I am aroused by robots or android-like beings. This, which is probably going to become more and more as life goes on. So here's Freud, a lot of how the theories about how this all develops and all that. That. Um, how do we seek treatment? Right? Do people obviously for certain items there's court ordered treatment, right? Pedophiliacs they need to have court ordered treatment. Couples that's for their own treatment, etc. Uh, CBT, cognitive behavioral therapy, social skills training. There's 12-step programs for sex addicts, just like there is for alcoholics. There's medications for pedophiliacs. There's medications, obviously, for sexual dysfunction and all that stuff, right? What we see as extreme sexual behaviors, other cultures may not, obviously, right? We talk about this. The cross cultural extremes. You're going to read all this. Extreme sadomasochism, right? We talked about this. Kinky sex can be sadomasochism, but it can be many other things. Mm. Uh, Furries. So I actually had a student that come into my class one time to drop off some papers dressed as a furry. It's people that wear animal costumes and engage in sexual acts, sexual tourism. Obviously, the internet has done this, and people go to Thailand to have sex with minors. People go to different places to have different types of experiences. Uh, Novelty in healthy sex is exploration. Toys. Do you use objects? Right. Some meant for sex and some are not. Uh, how do you accept yourself? Talk about that. All right. Here's what is your position. And you believe there are major contributors to the provisions of freedoms of sexual expression during the past century. And I talked about the changes in the last 75 years. Um, how have sexual values shifted in the United States? I mentioned that things are very different. And I was just a baby in the 50s, so I don't really know, but I know just from reading and history and stories, right? Um, so who should be allowed to decide what's normal and abnormal? And obviously, we're going to go look at the DSM, and these are the people, right? So a group of psychologists, doctors, uh, decided, psychiatrists have decided what's normal and what's not normal by writing the DSM-5. So uh, these are the people that describe it. Like I said, back in it wasn't that long ago that homosexuality was described as a mental disorder. Then they chose to change that in the next version of the Diagnostic Statistical Manual, which is what we do. Um, so let's see. So this is the book, the DSM, as we commonly refer to it, the Diagnostic and Statistical Manual of Mental Disorders. So this is how I diagnose somebody based on the criteria laid out in these books. So, like I said, those people, those doctors, etc., are the ones that have made the decision. This is how we define it, and it has all these chapters, right? Um, and now I'm going to just show you briefly some quick uh, pieces out of the book. Okay. Shoot. All right. So here's a whole description of paraphilic disorders and what that means. Right, a couple of pages, and then here we are, voyeuristic disorder. I get sexual satisfaction by watching others without their knowledge. And that's what makes this a disorder mostly is the fact that it's without the other person's knowledge. I'm a peeping Tom, and what used to be called, right? So this is all a description of just that. And the exhibitionist disorder. I want people to see me, right? And here's the criteria. See, you got to be sexually aroused by exposing your genitals to pre-pubertal children, physically mature individuals, or pre-pubertal children into the physically. So one of these categories, right, have to be doing this for more than 6 months, and you can't avoid it. Uh, and so people go to jail for this. Right, but that's how it's laid out. Like these are the things you ask about. So the individual has acted on these sexual urges with a non-consenting person. Mhm. That's what makes it go into this book mostly, right? Characteristic disorder. I talked about that, rubbing against you in the club or the store or the bus. Sadomasochism. We talked. So all of this is laid out in there. And this is how you just. This is how we label people. put them into the category of uh, what is described as deviant behavior, have normal behavior, pedophilia, right, with children. All of this is laid out in this book, and I know this isn't the best copy. This is the best um, scans, but I didn't want to tear my book apart. They're very expensive. At any rate, you can go to the library and get one if you really want to read it, right? So transvestic disorder is still in here. And this is the latest edition and revision. So is that really still like a problem? Should that be in here? I think that's a good question. And will it be in the next version? We don't know. So that's just part of the book. I got a whole second, right? Like there's a lot of disorder, what they consider disorders. Here's part two. I'm just going to flip through here really quick, right? The other specified paraphilic disorder. So you don't meet the criteria for the entire criteria for those specific disorders that are in the book, but you meet the criteria of some of them or partially meet it of some of them, and so there's still something wrong, and so we just call it other specified and unspecified. So depending, and you could read this to see the difference. I mean, and if you go on to be a therapist, or if you go on to in the social sciences, you'll become, particularly if you go on to be a therapist or a psychologist or psychiatrist or anything like that. And hopefully, if you've an MD, you will become very familiar with that book. All right. That's it. We're done. You made it. Like I said in the beginning of this, I hope you enjoyed the class, and I really hope this class helps improve the quality of your life. Thank you for your participation, and good luck to you all in your future.